The next question here, can genetics play a role in the development of cardiovascular diseases?
Yeah, certainly. There are still, I would say, the most common reason for heart attack or heart disease may not be genetics. In the future, we may get more data and we might change our opinion. But as of now, most of the time, it's a lifestyle disease based on your whole, like we discussed, the diet, exercise, and everything. But genetics certainly play a part. There are certain individuals who get heart attacks or other heart conditions at a younger age. And when we talk to people, some would say, "Oh yeah, my dad passed away at 50, or my uncle has had a heart attack in his 40s, or had a bypass in their 50s, early younger age." What we consider family history for men, if they have any of the relatives, like male relatives, in their 40s or 50s, and female relatives before their 60th age. At an older age, anyone can get heart disease. It's not considered too much of a high risk from a family history standpoint, but younger age is certainly concerning. And those individuals, they may have a genetic risk factor, even though we don't check genetics for everybody because we don't know what are the genes that play a part. Because it may not be one gene. There may be multiple genes that are involved. At this time, there is no real data to pinpoint one gene and say, okay, if you have this abnormal gene, you have a higher risk of heart disease. So, so basically, if they have a family history, we consider that as a high risk and try to be more aggressive with them in managing their risk factors. Sometimes we put them on certain medications, which maybe we can talk in a little bit later. But certainly, genetics does play a part, and maybe in the future, once we have more data, hopefully we'll have some more objective and tests to detect those individuals at a higher risk.
Mm-hmm. So would you recommend maybe people who are a little bit younger to kind of talk to their parents or relatives to see if any of those could be a risk for their life?
Yeah, that's very good idea. People should know their family history. If they can, if possible. Then, of course, there are some individuals who are adopted or they may not know their biological family. But if you know, if there is a way to find that out, that can certainly help.